Yes, big up every time with everyone who is watching and everyone who is here today. Change of topic a bit, and we are doing heart attack today. Heart attack. And why are we doing heart attack? You've seen the reggae legend Fantan Moja has passed away due to heart attack, and you can remember the legend again, the legend himself, Peter Morgan, died of heart attack. So most people have told me that, Doc, now that you love reggae so much and this heart attack thing is on between reggae artists that are big artists, why can't you talk about heart attack? So today I'm going to talk about heart attack and things that bring it and how it comes. So big up every time with everyone who is on the chat, everyone who is watching, any new person who is here, everyone who is coming right here today. We want to talk about heart attack. And this is due to the kind of things that are happening. Peter Morgan died of heart attack. We have our new reggae legend, the other one, Fantan Moja, who has died of heart attack. So what is heart attack? That is what we want to talk about it today. We want to talk about heart attacks. We usually talk about heart attacks. We want to understand how it comes and how it makes a person lose life, So if you are new to the channel, always come to the chat and tell us where you are from. Tell us where you are watching from. Tell us which side of the country you are chilling at. Jamaican uncle is in the house. Jamaican uncle, big up. Thanks for tuning in. The topic of today is heart attack. Heart attack is the topic of today. We want to talk about heart attack. We want to know. So many important people in the society are dying because of heart attacks. We want to understand what is heart attack. And if you have any, what a heart attack is, you may start telling us, welcome. Access to you, Benjamin, and everyone in the chat. That is from Jamaican uncle. And he has said hi. So, you who is watching, who is coming here, don't just scroll and go, man. Don't just scroll and go. Come in and subscribe to the channel. Hit that subscription button, and like button. And if you have any question, please come to the chat and ask us what is going on in this platform. Today's topic is heart attack. Heart attack is today's topic. And Sha Travels, greetings Dr. Ben and chat. Thanks for tuning in, Sha Travels. Hope everything is okay. Hope everything is cool where you are. I've received several messages from my friends out there who are watching, from the guys who know that I love reggae so much, and they told me that, Doc, Fantan Moja has died because of heart attack. And Peter Morgan died of heart attack. And you are a doctor. Why can't you change the topic of the week and talk about heart attack? And that's why I'm doing today, heart attack. So what do we understand by heart attack? Welcome to the chat, everyone. Thanks for subscribing. Thanks for tuning in. And thanks for being there always in the chat. Now, there is we need to understand sometimes. There is one thing that we need to understand at times. The heart is a connection of several things. The heart, because we are talking about the heart attack, is a connection of several things. The heart itself, and then we have the heart itself, then we have the vessels themselves, and the heart itself has a blood supply, because the muscles of the heart need oxygen and nutrients. You get? Yes. So when we talk about heart attack, you should know normally that it is a connection of several things that are articulated, and their motive is to make you healthy when it comes to delivering oxygen and pushing blood to the system. You get that? So everyone who is in the chat, thank you so much for tuning in. Thank you so much for coming in, and also subscribing to the channel. So if you have a question or you're a new person to the chat, come to the inbox and do what? And ask me, where are you chilling at? Which town are you tuning at? Are you tuning this channel from? And we will interact and know. So today, as the topic stated, I've just introduced, sorry to hear about that, Share Travels. I had a heart attack 1 year ago. Yes, you see, that is one thing that we need to consider when we are giving this information out there about heart attacks. If you don't get immediate resuscitation and help, things may go bad. So when we consider talking about heart attack, we are considering a very important organ of the body. Without the heart, your organs will not get oxygen, and they will not get something that is called nutrients, because it's the one which circulates nutrients and oxygen around the body. So heart attack, another name of heart attack is called myocardial infarction. MI. Another name for heart attack is myocardial infarction. And what is myocardial infarction? Myo is muscles. Cardio is the heart. Cardiac system is the heart system, So myo is the heart. Cardial is the heart. Infarction is loss of oxygen, leading to death, So listen to me carefully. Another name for heart attack, the heart being attacked, another name is called myocardial infarction. So I want to break down the myocardial infarction word very slowly. Myo is called MYO, is muscles. Cardial is another name for heart. Infarction is loss of oxygen leading to death of the muscles of the heart. So simply means that heart attack, in detail, in simple terms, we talk about loss of oxygen leading to death of the muscles of the heart. You see, because another name for myocardial infarction is for heart attack is myocardial infarction. So I think that one we have gone very slowly for anyone to understand. Another name for, I'll repeat several times so that someone can get it. Heart attack. Another name is myocardial infarction. Myocardial infarction. Let me write that down. It's a very important thing. It's a very important thing. Heart attack. Another is myocardial. Infarction. So look at this. Heart attack. Another name is myocardial infarction. So myo, M-Y-O. Myo means muscles. Myo means this one. Myo means muscles. Cardial, heart. Infarction means loss of oxygen leading to death. So, in simple terms, heart attack is the muscles of the heart losing oxygen delivery and nutrients leading to their cell death. Heart attack, another name is myocardial infarction. So myo, muscles of the heart leading to loss of oxygen and death. See, very simple. But let's break down about these things. Heart attack is an emergency, is an emergency. And as we talk about heart attack, there's very specific things we should look at. The heart itself have blood supply. This heart has blood supply. This heart, let me put the heart up, because now we are talking about heart attack. This heart has got blood supply. Where will I hold this with? Get this. Yes, now we talk about heart attack. Now look here. This heart, this is your heart. This heart has got its blood supply. And this heart that you are seeing here, having its blood supply, we want to say that we have a coronary vessel that comes from, you see, this is the outer, and it drops oxygenated blood to the body. It takes, because when blood comes from the lungs, comes here and then it goes to the outer. But there is something that happens. As it pumps, there is left coronary artery, left common carotid artery, there is a flavian artery and brachiocephalic. So one of those takes blood back to the heart. Coronary means the heart. Hold. Now, so the carotid arteries, they take back to the heart, and then we have left ascending artery, which supplies frontal wall of the left ventricle. And where is the left ventricle? This is the left ventricle. So as it comes, there is one that is called left anterior descending artery. Left anterior. So it comes from the coronary carotid arteries, and then it comes and supplies this part of the heart. You see, very important and interesting. Even the heart itself has got blood supply. There is left circumflex artery, supplies the lateral wall of the heart. Lateral wall is sideways. So it comes and circumflex, it supplies the lateral. So imagine the artery comes from this one. As you pump blood to the body, other blood supply comes in the heart. So left circumflex comes and pumps this side, and right coronary artery. Here we have carotid, subclavian, and right subclavian artery. So right coronary artery here from the outer, where does it go? Supplies the inferior wall. This right, it comes and supplies blood here from the inferior. You see, sun is giving me a lot of time. Just hold. So Let's talk about right coronary artery. We have right coronary artery. You have seen right coronary artery here, which supplies it comes down and supplies here the heart. There supplies the sinoatrial node in the 60%. So here, as it comes, it supplies again here. So there is something that is called coronary artery disease. Coronary artery disease. Let me get something to hold this chart of mine so that you can learn well. To hold this chart of mine so that you can learn well. Yes, like that. So that way is you are. Let's talk about this now. We have said, let me repeat, that there is something called blood supply of the heart. The blood supply of the heart. So your heart is here. This is your heart. This one is your heart. So as this is your heart, there are some things you need to understand. Because the blood itself, the heart itself, let me repeat, it has got blood supply. So when blood comes from the lungs, it comes this side from the left and it enters here. And when it enters here, it comes to the left ventricle and it is pumped out of to go to the outer, to go to supply blood to the body. And you see the outer has come, it's descending here, going down to the body, from here going down. So there is right coronary artery which supplies blood down here to this place down, and then there is the other one, left coronary artery here, that comes and supplies blood here at the left atrium. Here at the left atrium there is a sinoatrial node that helps your body to pump, and then there is right coronary artery, that one, this one, we have talked about it, and it supplies even the AV node. There is left circumflex artery. It comes from this side, from the outer itself, and it circumflex. It is called circumflex because it turns and comes and supplies blood here. We are talking about the heart because let's understand how you supply oxygen to your body. This is how you supply oxygen to your body. Blood comes from the body, from this, and then it comes to the right atrium, to the left ventricle. It is pumped out to the lungs through the pulmonary artery, and then it goes to the lungs. After it comes to the lungs, it enters through the left atrium, and then it goes down to the left ventricle, and then it is pumped out. Now this blood that is coming from the lungs, it has oxygen. And when it has oxygen, if you pump it, now there is these arteries, right coronary artery and left coronary artery, and there is circumflex artery. It does not go to the body, no, it comes back to the heart. You see, so it comes like this and supplies the inferior part, and this one comes the other side and changes, supplies this side. You see, those are the mechanism how the heart supplies blood. So that is the normal anatomy, the simple anatomy that we know about how the blood is supplied in your body. Now let's talk about something that is called the causes, because as you supply a blood to your heart, and let me again repeat, we have said that heart attack, the other name is called myocardial infarction. Myocardial infarction, this is the other name of heart attack. Welcome everyone. I'm watching, I'm seeing I can see several people like Leila, Majay, big up yourself every time from the Jamaica, Leila from Gong, United of Gong. Thank you for tuning in. So the other name for heart attack is called myocardial infarction. And why am I doing this topic? Because people have told me that, Doc, our reggae artists are called, some of them are dying because of heart attack. And you are a doctor and you love reggae, man. Talk about this thing. Talk about this thing so that you can know what is the problem. That's why I'm talking about it today. Now, let's talk about the causes of heart attack. So, if anywhere, you go anywhere and you hear someone talking about heart attack, or myocardial infarction, just know it is the same thing. Heart attack or myocardial infarction. Minute, I push this one this side. Yes. And if you have a question today, I am going slowly so that we can understand these topics. I'm going slowly so that we can understand this topic. So, if you are new to the channel, my friends, hit the like button and subscribe. Okay, so where are we? We are at why do people get myocardial infarction. The simple thing that I've explained is myocardial infarction is heart muscles dying because of lack of blood that has oxygen and nutrients. And I've explained how the heart gets its supply. So let's talk about something here. So let's talk about the causes before we go to very specific issues. Let's talk about the causes of these things. Welcome everyone. If you are watching and you are new, don't fail to come to the chat and tell. Today even my grade 6 is learning with us. Oh, nice one. Thank you so much. I want her to be a doctor one day. I want her to be a doctor one day. Now, causes of heart attack. What are the causes of heart attack? Over many years of living and eating, you accumulate fats in the arteries that I've said. Left circumflex, right coronary artery, the one that comes and supply blood, oxygenated blood to this heart, does what? Accumulates. Let me get a pen. Accumulates what? Accumulates several. I want to draw this heart faster. Don't. Just be patient. Patient a bit. Just be patient a bit. I want to draw this heart here so that we can learn better. Yes. And if you have a question, hit the question. Let me get to know the question that you have. Okay. This is the heart. I'm drawing here. This is the heart I'm drawing. I want to draw this heart so that you can understand something that is very important. And if you have a question, don't fail to ask. Sometimes you can be confused of what is this doctor talking about? What is this doctor talking about? And this is the outer comes here and then it comes down. So today we are talking about heart attack, and my main thing is the cause of heart attack. And the other name for heart attack we have said is myocardial infarction. Myocardial infarction. That I've drawn here, that is, it's showing some green lines here, and then it comes here. So these ones are the veins that supply. You see, this one is the outer. It comes, but there are some veins that have picked up and they have come back to the heart. This one has turned, this side has come. Just to explain that this right coronary artery here, look at it, right coronary artery, this one that comes from the aorta has just come and supplied here. So what are the causes of heart attack? Over years of eating, living, feeling good, eating very heavy carbons, cholesterols, and nice sweet things, over many years of eating these things, you find that fat accumulates in your walls, arterial walls. Fats accumulate in your the right coronary artery and the left circumflex arteries. Cholesterol deposits form some thick things. They are called fatty plaques, and then they make the arteries not to contract and relax well, and the artery narrows, because now if there are fats that are accumulating inside, the artery will be narrowed. If the plaque ruptures, it can block the artery. Blood clot can form. Blood flow suddenly stops. And if blood flow suddenly stops, what happens? If blood flow suddenly stops, what happens is you kind of like don't get oxygen to your veins. Look at this. Over years of living, over years of eating chips, over years of eating McDonald's, over years of eating ugali, you start forming fatty plaques on your arteries. You see, you start forming fatty plaques, and they are hard. These fatty plaques that are hard, these fatty plaques on these arteries that supply what they do, they make your artery constricted. And if your arteries are constricted, what can happen? They cannot relax. So when they are constricted, they become smaller. Look here, so the blood flow here will be with a problem. But there is one thing that can happen again. This fatty plaque can rupture. This fatty plaque here, I'm talking about the vessels that are supplying this heart with blood. It can rupture and come and block the artery. Now, the other part that has not, this side will not receive blood. So, if they will not receive blood, oxygen will not be there, nutrients will not be there. Simple here. So fats are the main causes, fat accumulation, and cholesterol deficit causing plaques, cholesterol inside blood. Those ones are coronary arterial disease. We call it, time you hear me talking about coronary, no, I'm talking about the blood vessels, the arteries and the veins that supply the heart. Coronary, cardiac, coronary, myocardial, heart. You see, now the second cause is coronary arterial spasms, temporary severe narrowing caused by, when some people they smoke, when some people smoke, when you smoke, Sha Travel still says, I'm here. When someone smokes, you smoke, you are feeling so nice, smoking, releasing the smoke. What happens to your veins? You know, your veins releases nitric oxide, your arteries and endothelin. So they constrict. The smoke makes the arteries to constrict. So if this is the normal size of the artery, you find that because you have been smoking for so long, the size becomes smaller. The size becomes smaller. And God created the bigger size so that it can give enough oxygen to the heart. So you've been smoking and your arteries have become this wide. So you make your arteries, your heart, not to get enough blood carrying oxygen and nutrients. You get? And if they don't get enough blood carrying oxygen and nutrients, what happens? They start dying off slowly by slowly. So things that is called coronary artery spasms. Spasms, the constriction, they're becoming small. They're becoming smaller. Coronary artery spasm is becoming smaller because you are giving free. They are called free radicals. Smoking is equals to free radicals, destroying the arteries and constricting. So things that can give coronary arterial spasms are like cocaine, smoking, severe stress and cold exposure. Because when you are cold, you know, you have seen some people when they are cold, they are in the cold places, their fingers die off. It's because of coronary spasms, arterial spasms. They constrict. So blood is not passed to the other dimension in a good way. You get it? So that is the second well. The first one was fat accumulation and cholesterol. This one is smoking, severe stress exposure, the narrowing, the normal narrowing of the vessels. It is called spasms, arterial spasms. The third one is embolism. Embolism. What is embolism? What is emboli? When I'm talking about emboli, blood clot from elsewhere blocks a coronary artery. And you see, let's talk about blood clots. Let's talk about blood clots. Now, this is the heart. In the lungs, there is a clot that is traveling. And then when it comes to the right atrium, it passes, it comes here, it passes. When it goes to the outer, it incidentally locks here. It incidentally locks here. So the right coronary artery will not take blood to the heart. Will not take blood to the heart. And you see, maybe it's a blood clot that happened somewhere else, and it has been traveling in your body. Blood clot that has been traveling in your body. You see, very funny, eh? It's very funny. Blood clots can travel from your body and come and lodge in your heart. The pulmonary system from the heart coming to here, and then they block blood to come. So blood clot from elsewhere blocks the coronary artery. This one blocks the coronary artery, and then you don't get enough oxygen supply to the muscles. Remember, the teacher, big up yourself every time. Welcome, and everyone who is watching, big up yourself every time. Now remember that we have said another name for heart attack is myocardial infarction, death of the muscles of the heart, death of the muscles of the heart. And that is how, if you don't get oxygen, if your muscles don't get oxygen and you die off. That is coronary embolism, clot. Now we have something else that is called spontaneous coronary artery dissection. Spontaneous. Sometimes you can get these arteries because of high blood pressure or several things, they rupture, and then blood is not getting enough to the blood is not getting to the heart as needed. You see, blood is not getting to the heart as needed. So what do we do? What do we do when blood is not getting to the heart as needed? You will have oxygen insufficiency to the muscles of the heart. to the muscles of the heart. You see, can occur during pregnancy or after pregnancy. This is a common cause. So guys, if you are coming in right now, what you need to do is hit the subscription button. Hit the subscription button, and also do what? Don't leave without giving me a like, man, and tell us if you are watching from which state, which continent around the world. Tell us, come to the chat and tell us. So the other one is severe oxygen supply demand mismatch, type 2 myocardial infarction. Yes, take vitals aniambie. Take vitals za huyo msichana. Who is sick? Nani mgonjwa? Nani ameletwa mgonjwa? To go and find out. Severe oxygen supply demand mismatch, type 2 myocardial infarction, occurs when oxygen demand exceeds supply, such as severe anemia. Anemia can cause severe oxygen demand. I'll be in the background, so I'm listening. Yes, okay, uncle, no problem. I understand you have a lot of work today, and we gotta get to number 5. Sorry, there was an interruption. Severe coronary arterial dissection, that one we've talked about, when the right coronary artery has been disrupted and the flow of blood is not normal, or it has ruptured. I was talking about severe oxygen supply demand mismatch. That one is called type 2 MI. When you have anemia, shock, sepsis, very rapid heart beating. When your heart is beating so faster, no problem at Jamaican uncle. No, sorry, okay. When your heart is beating so fast, it doesn't mean that the delivery of blood is 100%. No, it means that some blood is not pumped to the maximum. When you are feeling palpitation or tachycardia means your heart beating so fast. It means there is insufficiency of blood being delivered. When you are pumping, let me demonstrate this. When you are pumping like this slowly, with the normal heart rate, look at these hands. It means blood is being delivered as needed. But when you are pumping like this, they are called tachycardias. It means the heart, the blood, it's fibrillating, and the power that the heart needs, the blood is not there. So the fibrillation are not delivering blood to the muscles where they are needed. You see, hypertension, respiratory failure, heart rapidly beating. You see, these are the things that makes a person to get heart attack. Let me repeat the 5 things. Let me repeat the 5 things that are very important. The 5 things that are very important are: 1 is coronary artery disease, coronary arterial disease. Coronary artery disease, like fat accumulation in the arteries. The other one is coronary arterial spasms, constriction. When you are smoking, every time you hear about spasms, just know when you are smoking and then they constrict, they don't pass enough blood. Another one is embolism. Number 3, a clot that has come from somewhere else going and lodging to the coronary arteries, and they are not. You see, coronary embolism is a clot. Emboli, it may be, embolism means a clot that is blocked the arteries and blood is not passing through. So you can even have a fat emboli, a blood clot emboli. Even air can be an emboli, because when there is an air lodge, blood cannot flow. And then you have this one, spontaneous coronary arterial dissection. When the vessels that pass blood, they have incidentally ruptured, or they are having an aneurysm, so blood is not passing well. Okay, oxygen demand mismatch, anemia, shock, sepsis, all those infections, hypertension, the heart having palpitation, beating so fast, you are not getting blood when it's needed. So what are the risk factors of these people that get these problems? The risk factors of these problems. Risk factors means what are the problems that are there? Who is at risk of getting a heart attack? Who is at risk of getting a heart attack? Increase in age, male sex, before menopause. Why? We will see why men are at risk of getting heart attack. More of age, increase in age. You know, when you increase in age, more fats are there and they have lodged. And as you increase in age, activity reduces. You have noticed that many people, when they increase in age, activity reduces. There is genetic disposition. Maybe the heart has a problem with the coronary arteries. Family history of premature coronary artery. There are things that you cannot modify. As you age, you cannot change your age. You cannot change your physical identification of a male or a female. If you are a male, you are a male medically. You see, so that one you cannot change. Family history of premature coronary artery disease, family history, genetics, the heart coming out with problems, genetic predisposition, those ones you cannot change. There are some things in life, these are risk factors that predispose anyone to what is called heart attack, myocardial infarction, muscles of the heart doing what? Dying because of lack of oxygen and nutrients. Blood is not getting there as needed. So you can modify this. There are other issues that you can modify, and these issues that you can modify are hypertension. Those ones you can modify, you can treat. Diabetes, you can manage. Smoking, you can stop smoking. You see, these are, I've put Fatola. Who do you think is going to win the World Cup? Spain or Argentina? I don't know. I will talk about that later. Let's take things that you can modify. Smoking, high cholesterol. Teacher, my bestie. Share Travels, welcome. Now, cholesterol high, those ones we can treat. Obesity, physical inactivity, yes. You check at Jamaican uncle, he's always up and down working for himself, manual work doing, and is far away from heart attack. You can stop taking alcohol. Alcohol brings a lot of cholesterol and other bad things and reducing your immunity, so you can stop. Chronic kidney disease, stress, and sleep apnea. Sleep apnea can be a problem, So those are risk factors, yes. Vehicles ziko aje?
Pressure iko 110/70. Pulse rate iko 9, oxygen iko 94. Pulse rate iko 74. Air caution iko 926.
Na kuna kizunguzungu. Acha nikuje. Let me come. Now, those are things that we have talked about. We have talked about two things, non-modifiable and modifiable facts about non-modifiable and modifiable facts about risk factors. So we go then, we say that there is a way these things come. Peace be upon you, Ahmed. Ahmed, big up yourself. Welcome to the chat. If anyone has a question, please ask. If you know there is any risk factor about, hi doctor, I'm fine. Look at this heart. Let me take care of this. In a minute I come. Just a minute. Hapa sita.
And then nikistress nasikia sijui nini na flow kwa mwili, nasikia joto baridi hapa hivi.
But ile siku yenye nilikupea zile dawa ulikuwa sawa. After we did the trip. You know what happens is hata nataka Dania sikia hapo wapi ameenda kwa nitie huyo nani, acha Dorothy amwite. Dorothy, ambia nani Rosa kuja huko.
Sasa nasikia huko
kwa nini? Dorothy, nitie Rose. Nitie Rose. And your dad homa ndio imemshika.
Alikuwa na mix madawa zingine hapo za siafu.
Oh, hiyo si homa. Hiyo inaitwa hyperreactivity, hypersensitivity. So anafaa kumeza something like prednisolone. And yes, prednisolone.
Wewe niliacha ameelekea madawa moja hapo.
Gani na gani?
Kusira
Benylin. Mwambie asimeze Benylin. Ameze tu paracetamol na prednisolone na nini nyingine.
Alitoa
azithromycin. Why? Kwani yako na homa? Hiyo si homa. Nilikuwa nataka nimexplainie hiyo kisikia about TSH. Sasa your demands in the body wanga ina activate pituitary gland. It produce thyroid stimulating hormone. So when it activates it, when it activates it, ina stimulate thyroid gland. Thyroid inatoa T4. Si ndio? T4 haikuangi active. Hiyo ina circulating tu kwa blood without doing anything. So your demand for metabolism ndio inafanyanga T4 ikue change to T3. T3 ndio iko active. Si ndio? So kwake yake ilikuwa T4 iko juu. TSH inatoka kwa nini iko. So inamaanisha what, and something is making T4 is not converted to T3. And that's why anasikia hivyo vile anasikia. Aona mwili yake vile iko sahi. Concerning alikuwa mslim sahi. So inamaanisha amekuwa akiundergo something. In turn niliona nini yake iko, tulipata endocarditis, ndio? The heart.
Okay.
And kwa jua hiyo ni secondary to smoking.
Ilipima kwa blood?
Aliniletea hiyo nini na nikapima blood. So ECG. So it means that the endocarditis plus infection ndio ilikuwa ina stop. Umeona? So for now vile ameanza treatment, what should we do? We should not add so many, although steroids huwa zinafanya hizo corticosteroids huwa zinasaidia at least hizo T4 na T3 kukua suppressed. The other issue of steroids is gain weight. So for now what I can do for you ni kumpea Dexa na NS. Acha kusikia hivyo. Alafu uende na prednisolone. Usimeze kila saa. Anytime una feel your dizziness ndio una take. But there is another thing that causes the same problem. Prolactin hormone. Hiyo iko kwa women. Kama iko juu sana utakuwa na problem na thyroid. Na inakosingi menses and zenye ziko unstable problem with message for which you have. Na hiyo to be sure test na kufanya MRI.
Okay.
Lakini tuangalie kwa brain kama that pituitary gland iko na problem. But for now, do you think we should go that far? I don't think so.
So pia inaweza kuwa sio pressure nasikia kwa masikio.
Alafu sometimes hapa unaona hii part nasikia tu sauti weird.
Ni kama kitu inaendelea kwa nini kwa brain. Today's topic is heart attack. Mtu ana text up. Nini let's get to this week. Before tumeanza treatment. This week tufanye hivyo, we don't rush to things. But if it persists, tafanya MRI.
So sasa hii ati utamdunga Dexa?
NS moja dexamethasone and then I give prednisolone when necessary.
Akisikia hiyo feeling
when necessary. But unakumbuka the first day ulala vizuri sana.
Okay.
Which means that medication plus the steroid again irudisha chini. But you see it can also gradually go down. Si lazima ukiweka leo immediately. Unaona? That is what I do for today. And then you check yourself. Ukiona ina persist uniambie, nitakutumia request uende upigwe MRI.
Okay. Na mimi siku hizi niko na palpitation mingi sana.
Bado unaenda gym?
Sasa siningeacha juu sijai hata kuumwa na hapa.
Dorothy. Kuja. Bado unaumwa na hapa?
Sasa nikaoniacha gym.
Nidunge hapa.
Bado unaonekananga hapo.
Utaenda naye nimalize hii. Umpe Dexa. How many? 12. 12. Na 8. Tajua vile nitafanya plus nini? Hiyo ingine ni nini? Normal saline 500. Sawa? Niende slow. Saline 500.
Sasa nikuulize hii ni kitu yenye inaweza kuwa treatable, like ni kitu inaja tu kuisha
Nataka apone endocarditis kwa.
Okay.
Because that is the more worst. Advance zake zikikosa na vile nikasikia kadogo saa hivi kadogo. Advance zake zikikosa zikifail saa hii itakuwa
na msasa
but nilikuwa nataka kufanya tu MRI kwa shwari. Ndio. Lea asli kalale vizuri.
Ama tufanyiwa MRI tuange
Tumalizane na tunanibaki na blood nifanye prolactin levels. Because pituitary gland ikiwa na shida prolactin zinakwenda juu.
So mtoe damu zaidi.
Ila mtoto. Badala ya kutoa tena.
Huko kwenye unaweza kulifaa na opsi mbali.
MRI. MRI atapigwa kesho.
Nimeanza ni wapi?
Tao.
Gai.
Huko unajua si unasikia? Afadhali uende utumie. Si ndio? Kwa ule jamaa
Umeona leo? Okay.
Dorothy. Amen.
Pia leo natoka mobile sema kwa hiyo kunatoka
Kidogo.
Nini hiyo? Damu.
Ongea tutachukua hizo. ndio daktari siogopangi damu.
Nasema hivyo tu.
Haya.
Nilimupima.
Sawa.
Mimi si mgonjwa.
Wewe si mgonjwa?
Sasa
Sababu enda na mimi niulize hii maneno ya palpitation.
Siwache nimalize alafu before muende mgeni tuonge. Haya, Masia, I'm here. I am here. Now let's talk about yes, sorry my guys, sorry for that short period of distraction. I'm here. So what's the time? 5:30. Let me check. Just a minute, don't go. Let me tune up something here. Yes, sorry guys, sometimes you have to work and you have to do some things. So I've been working on a patient, but right now I'm back. We can do 1, 2, 3 things as we continue on this topic of heart attack. Thank you so much for everyone who has waited and who is here still pushing on and doing ABCD. Remember, the topic of today is heart attack. Heart attack, we have said, is another name is myocardial infarction. Myo is muscles of the heart caused by the death caused by lack of oxygen. So I've gone through what it entails. And what it entails is the three causes. The causes, not the three causes. The causes of heart attack. One, we have said, is coronary artery disease, coronary arterial spasm, coronary embolism, spontaneous coronary oxygen supply demand mismatch, severe oxygen supply demand. So severe oxygen demand mismatch means the heart needs the oxygen, but you have anemia, shock, sepsis, very rapid heart rate, and severe hypertension and respiratory failure. That is where the problem lies. But we have said again, there are some people that have risk factors of this problem. What are the risk factors of this problem? Who is at risk of getting the problem? And who is at risk of getting the problem is one. We have two ways. Marcia Thompson, hey, welcome. Marcia is still here. Greetings. And Hamed, please translator on. Oh, okay. Ahmed was listening to the previous calls. Murato Guza, how are you, my black brother? Murato Guza, I'm fine here in Africa, Kenya. I'm doing so fine. Murato, may God protect you. Thanks a lot. I thank you for being there, and also may God protect you through Murato, wherever you are. Thanks for your touch up and line. Thanks for everything, man. Thanks for everything. So let's continue and talk about these things. Heart attack. People want to know. I've talked about something that is called risk factors that are modifiable and those ones that are not modifiable. So those ones that you cannot modify, once you are having, you can get you are at risk of getting a heart attack. Age, you cannot modify. Sex, you cannot modify. If God brought you in this world as a man or a woman, you will never modify. Even if you behave like a woman or you are a man, you will never modify the hormones that are in you. That one is non-modifiable. Family history of premature coronary artery disease, the coronary artery disease, these ones, the arteries that bring back the blood to the heart. If you have family history problems, genetic predisposition also, God is with the Muslim Brotherhood and the Black Brotherhood. Thank you for your compliments. Modifiable, those that you can help and modify yourself. Which are these ones? Hypertension, diabetes, smoking, high cholesterol, obesity, physical inactivity, unhealthy diet, excess cholesterol, chronic kidney disease, and stress, sleep apneas. Those ones you can modify. Those ones you can modify. Now, let's get to something that is very important here. The pathophysiology. What is pathophysiology? Pathophysiology means how these things comes out, how it starts. You know, fat accumulates beneath the artery wall. I've said. Yeah? Then it causes the arteries to be stiff. These arteries to be stiff, it is called atherosclerotic plaque. Plaque ruptures. As it is stiff, it ruptures and blocks the arteries. You see, it ruptures and blocks the artery. Yeah? What we are talking about is these coronary arteries, right and left coronary arteries. Yeah? Plaque sticks to rupture. Yeah? Blood clot comes in and forms, because if it ruptures, if this plaque was attaching to a vessel, if it comes out, maybe it can bleed and then it can cause a blood clot. Then it blocks the artery and then your heart cannot get enough oxygen. The muscles no oxygen, and then muscles begin to die. You know, if your muscles don't get oxygen between 20 to 30 minutes, they will start to die off. They will start to die off. Ischemia happens in the blood. Then muscle is replaced by a scar tissue. You see, another thing is here. Another thing is here. If these muscles die, and then after 1 hour, that is when you are coming to hospital because you have chest pain. This place will have already, the cells here will have already died. So what happens is, there will be a scar. I don't know if, yes, this is a scar of when I was young, I was given BCG vaccine. So it left a scar. So something like this scar comes to your heart. And if it comes to your heart, it means that contraction of this heart and relaxation is a problem. You see? So that is what is there. You see, very complicated but straight. Complicated but straight. Hope and if you are not understanding this thing, please let me. If you are not understanding this thing, please just ask. I want everyone to understand. I want everyone to understand what I mean. You know what I mean by the heart attack. You see. So if you have arterial plaque, cholesterol have blocked, or the plaques have blocked and then you coming to hospital after 1 hour, the situation has started, the muscles have started to die. That is a great problem. And it's a problem. It will mean your muscles will. That's why I want every person to know. That's why if a person had the first heart attack and it took so long to get to the hospital, like more than 2 hours, the muscles and the cells of the myocardial cells will have started having a problem and they will have started dying off. So if they will have started dying off, what does that mean? It means that the contraction and relaxation of this heart most of the time will not be normal. So the first heart attack you can save. Second one and third one is a problem because it means there is a chronic myocardial infarction Myocardial infarction, you've said, is the death of the cells of the myocardium. If there is an uncontrolled myocardial infarction, and if there is uncontrolled myocardial infarction, what does it mean? Cells are progressively dying. That's why you hear doctors saying that the first heart attack you can save, the second and the third is a problem. So as per that, we have talked about the heart attack. As per what you have seen, we have something that we call type of heart attacks, types. And this one are medical types of heart attack, medical, not the ones that we did previously. Let me do something here. Types of heart attack. STEMI. We have STEMI. ST elevation myocardial infarction. ST elevation myocardial infarction. And then we have NSTEMI, non-ST elevation. And we have type 2 myocardial infarction. I know someone is being confused about the STEMI, and we talked about something that is called the ECG. And now, because I'm talking about heart attack and I want people to understand, I think whatever I've given today is enough, because if we start talking about STEMI and ST elevation, ST elevation is a representation that happens when you put a person in an ECG. An ECG is called an electrocardiogram. An electrocardiogram is an electric impulse that shows us the waves and the waves, showing us polarization and depolarization. That is not a big word. It's called contraction and relaxation of these muscles of this heart, right from the pole. So tomorrow, as we start learning about types of heart attacks, we will know about what is the P wave. I will repeat, because we did this about an ECG. What is the P wave? What is the T wave? What is the R wave? PQRST. So the P wave, let me just bring it. Let me share about it a bit before tomorrow, so that someone cannot say, Doc, you just told us about the types of, and you did not even explain about them. You did not even explain about them. Let me highlight it. So that you can understand. Tomorrow when you come, you can understand the types of, I've said, we have types of heart attack. We have the ST elevation heart attack, STEMI, we call it STEMI and STEMI, non-ST elevation myocardial infarction, and the third one is called type 2 myocardial infarction, not due to plague or rupture. It's not due to plague or rupture. So today I will stop there, because if I continue I start bringing STEMI right now, you need to understand what is S wave, what is T wave, what is P wave, and this is what I mean. Just a minute, my guys. Just a minute. This is what I mean. STEMI, ST elevation. This is what I mean. When I want to know how this heart is contracting or relaxing, is it normal? Is the heart rate normal or abnormal? You are put on probes, and the probes are represented with a monitor. So when this heart contracts, you have an arterial node, and I think I have to put that thing here. Put on a monitor. I know some people know how you have an idea of an ECG. There is a sinoatrial node here that fires. When it fires, it is called right atrium to contract, and when it contracts, it pushes blood here. When it fires, the positive ion, I'll explain it tomorrow about that. So that we can understand the types, you need to know about the functions of electrocardiogram and how electrocardiogram fires the electrical system. So when I say ST elevation of a myocardiogram, when I say ST elevation, it means, in simple, these ventricles depolarizing and repolarizing is very slow. It means the myocardiums have a problem. You see, but when I'm saying NSTEMI, the other type, the second type, none, it means that the ventricles are okay. The firing is proper, the ventricles are okay, but there is occlusion in the coronary artery. So before I leave today, I want to understand anyone who has a heart attack, and people had said that we need that topic today. I don't know why, because I explain it from the beginning. Anyone with any question before I leave? Before I leave, anyone with any question on heart attack or any medical question? You know, we talk about very many questions that are connected. Anyone with any question? So a recap of today's topic, we have started talking about heart attack. The other name for heart attack is called myocardial infarction, and myo means the muscles. Myo, any type of, you hear any medical word starting with myo, M-Y-O. Anytime you hear any word starting with M-Y-O, just understand it means muscles. Cardio is the heart, cardium. Pericardium is a muscle. So cardio is the heart. So it means the muscles of the heart. And then you have another word there that is called infarction. Infarction means what? Infarction means death. Cell death due to oxygen deprivation. And you see, something that takes oxygen to your muscles is what? Something that takes oxygen to your muscles is blood, red blood cells. And if the delivery of red blood cells to these muscles here is a problem, it means cell death. That is infarction. Infarct means a part of the muscles that has died. And that's why we have three types of heart attack, or three types of MI, myocardial infarction. What are these three types? Non-ST elevation heart attack, and then we have another one, ST elevated heart attack, and then we have the other one, number 3, is type 2 myocardial infarction. Type 2 myocardial infarction. So, hey, sorry my people. Hey, so those are, if I start explaining about ST elevation myocardial attack and I've not taught someone what is ST, you'll be confused. That's why I'm stopping there, so that tomorrow we can start another topic that is called, I'll do the echo. But you can go and see the other things that we did on the echocardiogram, revisit them so that you can know. Why is this net so slow today? Revisit them so that you can know tomorrow. I will do a video and post on. I'll do a video and post on PQRST complex. It is called PQRST complex on on heart attack. So it's 5:51. Anyone with any question? Anyone who thinks not understood anywhere, or anyone who has any question, bring it up. Bring this question up so that we can learn, both of us. I have 2 minutes. No, 2 minutes. I have 2 minutes. Anyone with any question up to there? I've introduced something that is called heart attack, given the risk factors, modifiable and non-modifiable, and we have categorized heart attack. So if you are watching and you have a question, you are there having a question, push it up, bring it to the table. Bring the question to the table. Bring the question to the table. I'm waiting for any question before I leave, my friends. I'm waiting for any question before I leave. Sorry about the break. When you are working and you're saving life, you have to get through sometimes and start. Anyone with any question, my friends? I'm waiting for anyone with any question. Yes, I think that is the day. Let's call it a day. See you with the next live and lecture. Bye bye. Can medication slow down the fast beating if the heart is the one? Those are called palpitations. Yes, you can use beta blockers like propranolol. Propranolol work on the muscles of the heart. They work on the muscles of the heart. They are called beta blockers. So they slow the beating of the heart, the contraction and relaxation, and they tune the fibrillation. Fibrillation is severe tachycardia. Fibrillation is severe tachycardia, and that's why some people that have problems when it comes to contraction and relaxations, they are put on beta blockers like propranolol. Medication is a good thing. Or when you're having fibrillations and you are being taken in ICU so fast, we give you some drugs that are called amiodarone. Amiodarone, they relax the heart not to have fibrillations, but we give it away because if a person has something that is called a bundle block of the heart, that person can, so you give it with caution, and that one is being given by consultants, not anyone. Over-the-counter medications after prescription, those ones are like propranolol, and then you are good. I hope you understood that one. Medications are okay, so appropriate. Okay, let's meet to the next one. Everyone have a nice and lovely time. Morning, evening, wherever you are. Good one. Yeah.